Now we're going to go over the female genital system. The terms you need to write in your book are colpo for vagina, mammo for breast, meno for menstruation, O for egg or ovary, ovi for egg, O4 for ovary, salpinge for tube, raphe for repair, and pexy for surgical fixation. Anatomy. The vagina is the passageway from the uterus through the cervix to the outside of the menses. It is the birth canal and where sperm is deposited during intercourse. The uterus is situated between the bladder and the rectum. It resembles a flattened pear and is the size of a clenched fist. The cervix is the lower part and opening of the uterus. It serves to protect the internal female organs from infection. During labor, this amazing organ can stretch from pinhole diameter to 10 centimeters, allowing a baby to fit through. Fallopian tubes are about the caliper of a drinking straw and 3 to 5 inches in length. The tubes are the conduit for an egg from the ovary and for the sperm from the vagina through the cervix and uterus into the tube. Fertilization of the egg by a sperm occurs in the tube. Ovaries are almond-shaped and the size of a small plum. The ovaries store ovum or eggs to be released at ovulation. At birth, a female has all of the eggs in her ovaries that she will ever have. Through the monthly cycle, an ovum matures under hormonal control. At ovulation, the egg is released from the ovary through the fimbriae and portion of the tube into the tube. Here is the female genital system. You have the vagina, the cervix, the uterus, fallopian tubes, and ovaries. Make note that you have 2 ovaries and 2 fallopian tubes. This will be important when coding. The sections that are in this chapter are the vulva, perineum, and introitus, the vagina, cervix uteri, corpus uteri, ovary, in vitro fertilization, maternity care, and the endocrine system is at the end. First, we're going to talk about the vulva. The vulva is the external genitals of a female. There is an incision section, destruction, and repair section that are important here. I want to look now at my code book at this section. This is the first page of the vulva section. And like I said, the vulva is the external female genitals. So let's take a little bit of a closer look. I hope you guys can see this. Look at the beginning of the section and read these guidelines. In multiple procedures, it will say simple or radical or partial or complete. And these are the guidelines that you need to follow on what those mean. A simple procedure is the removal of skin and superficial subcutaneous tissue. A radical procedure is the removal of skin and deep subcutaneous tissue. A partial procedure is the removal of less than 80% of the vulvar area, and a complete is the removal of 80% of the vulvar area. Look at how I bracketed these vulvectomies into simple, radical, and you could even bracket the completes. Notice the parenthetical notes under the vulvectomy procedures, and make sure to highlight those in your book. Remember, the destruction section is not the excision section. Destruction happens by laser surgery, electrosurgery, cryosurgery, or chemosurgery. I have a note at the top of my book that says radical equals removal of deep and subcutaneous tissue. I probably wrote that note just because it was a question that I had that maybe I got wrong because I didn't notice it over here on the left-hand side, but I know that when I write notes in my book, it stands out to me more. We're going to continue looking in my book. Now go to the cervix uteri section. As you can see, the first section is the endoscopy section. With the endoscopy in this section, it's still called a colposcopy of the cervix, including upper adjacent vagina. If it's just diagnostic, that is your code 57452. If they also do a biopsy of the cervix and endocervical curettage in it, then it's 57454. With biopsies of cervix, it's 57455. And remember, that S in parentheses means they could do 10 biopsies, but it's still only going to be coded once. 57456 is with endocervical curettage, and 57461 is called a LEAP procedure with loop electroconization of the cervix. Note that I put a note here that says if this is not done through a colposcopy, see 57522. Now let's look at the corpus uteri section. In the excision section of corpus uteri, the first code is endometrial sampling, or a biopsy, with or without endocervical sampling biopsy, without cervical dilation, any method. Note, this is a separate procedure, and remember, what do we do with separate procedures? They can't be coded when other procedures are coded at the same time on the same body area. Directly underneath that, there is an add-on code for endometrial sampling biopsy performed in conjunction with a colposcopy. So you would not code 58100 if a colposcopy was done. You would code 58110 with the colposcopy. 58120 is for a D and C. That's what they call it a lot, is dilation and curettage, D and C. Diagnostic or therapeutic, non-obstetrical. So that means non-obstetrical. It's not, the patient is not pregnant. Now, if it was obstetrical for postpartum hemorrhage, see 59160. That's a parenthetical note you should put a star next to. On the next page is a pretty important page. It has to do with hysterectomies. So let's get started on the hysterectomy procedures. Hysterectomy procedures are labeled up here with hysterectomy procedures. Now note, I put a note at the top of my page that says TAH stands for total abdominal hysterectomy. And BSO stands for bilateral salping orphectomy. And we'll go over what that means here in a minute. But the first hysterectomy code, the first two are TAHs, total abdominal hysterectomies. So this first one is actually a TAH-BSO. So that means it's a total abdominal hysterectomy, bilateral salping orphectomy. So the code says total abdominal hysterectomy, corpus and cervix, that's what that means, with or without removal of tubes. So that means they are removing the tubes, without removal of ovaries. So what that means is they could have removed the entire cervix, ovaries, and fallopian tubes, and that is a salping orphectomy, a TAH-BSO. Now there is an indented code 58152 that's with colpo-urethro-cystopexy, and that is a repair of urethro bladder. 58180 is a subtotal abdominal hysterectomy. So the supracervical abdominal hysterectomy. It's not a total. 58200 is a total abdominal hysterectomy and a partial vaginectomy. So it's both. And 58210 is a radical abdominal hysterectomy. Now, 58260 is a vaginal hysterectomy for uteruses 250 grams or less. And if you go up here, the indented codes underneath it are on the next column. I'm not sure if that's how it is on your book, but that's how my book is. And if they did a removal of tubes and ovaries, it's 58262. If they did a removal of tubes and ovaries and a repair of the enteroceal, it's 58263. Now, your next code is 58275, which is a vaginal hysterectomy with total or partial vaginectomy. If they also repaired the enteroceal, it's 58280. Now, we just talked about the vaginal hysterectomy for uteruses less than 250 grams. Now, these are the same codes, but for uteruses greater than 250 grams, and those start at 58290 to 58294. The introduction section of this is a pretty common section. I'm sure everybody's heard of an IUD. That's where these are coded from. 58300 is insertion of intrauterine device, which stands for IUD. And then if they are removing it, it's 58301. Artificial insemination is next. I bracketed these three codes. If they do the artificial insemination intracervical, so inside the cervix, then it's 58321. If they did it intrauterine, which is inside the uterus, then it's 58322. Then there's a code for sperm washing for artificial insemination. Now we're going to talk about the laparoscopy hysteroscopy. The guidelines in this section state surgical laparoscopy always includes diagnostic laparoscopy. To report a diagnostic laparoscopy, use 49320. To report a diagnostic hysteroscopy, use 58555. Let's look at these codes together. 58541 is a laparoscopy surgical supracervical hysterectomy for uterus 250 grams or less. And the indented code underneath it is with removal of tubes and or ovaries. Supracervical is the top portion of the cervix, not the entire cervix. 58543 is a laparoscopy surgical supracervical hysterectomy for uterus greater than 250 grams. 58545 is laparoscopy surgical myomectomy excision, so a fibroid tumor, 1 to 4 intramural myomas with total weight of 250 grams or less and or removal of surface myomas. Now that was for 1 to 4 myomas. The indented code underneath it, you would report if there were 5 or more intramural myomas for a uterus total weight greater than 250 grams. 58550 is a laparoscopy surgical with vaginal hysterectomy for uterus 250 grams or less. 58553 is for a uterus greater than 250 grams. Now let's talk about the hysteroscopy procedures. As you can see in this illustration over here, that is a hysteroscope. A resectoscope is inserted and it goes in through the vagina up into the uterus. So the diagnostic procedure is 58555 and 58558 is a surgical hysteroscopy with sampling biopsy of endometrium or a polypectomy with or without a DNC, a dilation and curettage. And then you have a with lysis of interuterine adhesions with any method could be used for that. Down at the bottom, 58565, you have with bilateral fallopian tube cannulation to induce occlusion by placement of a permanent implants. Notice the parenthetical notes to do not report 58565 in conjunction with 58555 or 57800. And unilateral procedures, you should use a 52 modifier. So if it wasn't done on both fallopian tubes, there's not a code for just a unilateral fallopian tube cannulation. So you would need to put the 52 reduced services modifier on that code. Then I have bracketed, you can't really see the bracket, but I have bracketed from 58570 to 58573 for the laparoscopic hysterectomy. These are the total hysterectomies. And the first two codes, 58570 and 58571, are for a uterus 250 grams or less. And 58572 and 58573 are for a uterus 250 grams or greater. So the first code says laparoscopy surgical with lysis of adhesions. And notice in parentheses, this could be called a salpingolysis or an ovariolysis. Lysis means lysis of adhesions. So salping means ovary. So that's why it's called a salpingolysis. And then underneath that are other procedures that can be performed via laparoscopy. Notice 58672 is a laparoscopy with fembryoplasty. I did want you to know that on 58672 and 58673, I suggest putting a note that says, if bilateral, use a 50 modifier. In the excision section for the ovaries, you have a salpingectomy, which is removal of one or both of the fallopian tubes. If they remove both, you do not put a 50 modifier because bilateral is in the description of that service, and it is only coded one time. A salpingorphectomy means they are removing both the tubes and the ovaries, and this again is partial or complete, unilateral or bilateral. So since bilateral is in that procedure description, you will not use a 50 modifier. In the repair section, the first code is lysis of adhesions, just like the first code in the laparoscopy section, but this is open instead of done laparoscopically. Lysis of adhesions is called a salpingolysis or an ovariolysis. Notice the parenthetical notes underneath it. It says, for laparoscopic approach, it refers you to that 58660. In the incision section for the ovary, you have a drainage of an ovarian cysts, unilateral or bilateral. Now these are coded by approach, so that 58800 is for the vaginal approach, and the 58805 is the abdominal approach. If they are draining an ovarian abscess, it's coded the same way by approach. 58820 is vaginal approach and 58822 is abdominal approach. In the excision section for the ovary, you do have a biopsy of the ovary, unilateral or bilateral, and that is a separate procedure, 58900. If they do a wedge resection or bisection of ovary, unilateral or bilateral, it's 58920. An oophorectomy, partial or total, unilateral or bilateral, is the same thing we talked about with the fallopian tubes, but this is for just the ovaries. And indented underneath that is for when they do an oophorectomy, partial or total, unilateral, bilateral for ovarian, tubal, or primary peritoneal malignancy. And let's talk about the in vitro fertilization section. So there's only 3 codes for in vitro fertilization. The first one is 58970 for follicle puncture for oocyte retrieval, any method. The 58974 is embryo transfer intrauterine. And 58976 is gamete, zygote, and embryo intrafallopian transfer, any method. We're going to talk about maternity care and delivery. There are guidelines at the beginning of this section that I want to read together. The services normally provided in uncomplicated maternity cases include antepartum care, delivery, and postpartum care. Pregnancy confirmation during problem-oriented or preventative visit is not considered part of antepartum care and should be reported with the appropriate E&M service code. Antepartum care includes the initial prenatal physical examination, subsequent prenatal history physical examination, recording of weight, blood pressures, fetal heart rate, route chemical, and monthly visit up to 28 weeks of gestation. On the next page, the guidelines state delivery services include admission to the hospital, the admission history and physical, management of uncomplicated labor, vaginal delivery with or without episiotomy, with or without forceps, or cesarean delivery. When reporting delivery services, report inpatient post-delivery management and discharge services using an E&M code. Delivery and postpartum services include delivery services and all inpatient and outpatient postpartum services. Medical complications of pregnancy, such as cardiac problems, neurological problems, diabetes, hypertension, toxemia, hyperemias, preterm labor, premature rupture of membranes or trauma, and a medical problems complicating labor delivery management may require additional resources and may be reported separately. Postpartum care only services are coded with 59430, and this includes office or other outpatient visits following vaginal or cesarean delivery. For surgical complications of pregnancy, see services in the surgery section. If all or part of the antepartum or postpartum patient care is provided except delivery due to termination of pregnancy by abortion or referral to another physician or other qualified healthcare professional for delivery, see the antepartum and postpartum codes. Note the parenthetical note under the guidelines for circumcision of a newborn, see 54150 and 54160. Now let's talk about the antepartum and fetal invasive services. An amniocentesis is when they are drawing fluid, amniotic fluid, from the mother. An amniocentesis diagnostic is 59000. If they are doing it for therapeutic reasons, for fluid reduction, 59001 should be reported. Note that 59001 says that it includes the ultrasound guidance. Up here, this is a illustration of an amniocentesis where you can see the needle going into the amniotic fluid and draining it out. Now let's look at the excision section. Hysterotomy abdominal is cutting into. A 59120 surgical treatment of ectopic pregnancy, tubal or ovarian, requiring salpingectomy or oophorectomy, abdominal or vaginal approach. And the indented codes underneath it are tubal or ovarian without salpingectomy or oophorectomy. 59130 is abdominal pregnancy. 59135 is interstitial uterine pregnancy requiring total hysterectomy. And 59136 is interstitial uterine pregnancy with partial resection of uterus. And 59140 is cervical with evacuation. Let's talk about delivery. So 59400 is for vaginal delivery. Look at the coding tip on this page. Instructions for reporting antepartum and postpartum care. The services normally provided in uncomplicated maternity cases include antepartum care and postpartum care and the delivery. Antepartum care are the visits that you go to before delivery, and postpartum are the visits that you go to after delivery. Now, there are cases where one doctor will do the antepartum care and a separate doctor will do the delivery, and there is different coding scenarios for that we're going to talk about. But if it's the same doctor that does your antepartum, delivery, and postpartum care, it's all bundled into one code. So for a vaginal delivery with antepartum and postpartum care, you would code 59400. If the doctor only didn't do the antepartum care, but did do the delivery and the postpartum care for patients that might have moved or switched doctors, then that would be coded with 59409. The doctor that did the delivery and postpartum care would code 59410, and the doctor that did just the antepartum care would code either 59425 or 59426 for antepartum care only. It depends on how many visits that patient went to for that doctor. So if it was 4 to 6 visits, it's 59425. If it was 7 or more visits, it's 59426. And opposite to that, if postpartum care is the only care that was provided by a physician, it's 59430. Cesarean delivery. Let's read the coding tip. Patients who have had a previous C-section and now are present with the expectation of a vaginal delivery are coded with the code range 59610 through 59622. That code range is over here under the section Delivery After Previous Cesarean Delivery. If the patient has a successful vaginal delivery after a previous C-section delivery, VBAC, use codes 59610 through 59614, the same codes over here. If the attempt is unsuccessful and another C-section delivery is carried out, use the code range 59618 through 59622, and we'll see those here in a minute. To report an elective C-section deliveries, you use code range 59510, 59514 or 59515, which are these under here that say routine obstetric care, including antepartum care, C-section, and postpartum care. And if it was just the C-section delivery only, you would use this. If it was C-section delivery with postpartum care, you would use 59515. If after the C-section a subtotal or total hysterectomy was done, then you will use add-on code 59525 right here. The guidelines under delivery after previous C-section are patients who have had a previous C-section delivery and are now present for vaginal delivery. You use this code range, which is what we just talked about. These codes are 59610, routine obstetric care, including antepartum care, vaginal delivery, and postpartum care after previous C-section. And if it was a vaginal delivery only after previous C-section delivery, you will use this code. And if it includes postpartum care, you will use 59614. I do have a note on that 59510 over here for the routine C-section that you will only code 1 for twins because it is a C-section. So this is the code 59618 that you will use if an attempted vaginal delivery was done after a previous C-section and it was unsuccessful and they had to do another C-section. You will use 59618. For the C-section delivery only, followed by the attempted vaginal delivery, you will use 59620. And for the C-section only, following attempted vaginal delivery with postpartum care, you'll use 59622. And the last section of this chapter is abortion. So there is 59812, which is treatment of incomplete abortion, any trimester completed surgically. And then there's 59820, which is treatment of missed abortion, complicated surgically, first trimester. And then 59821 is for second trimester. And for induced abortions, 59850 is induced abortion by one or more intra-amniotic injections, amniocentesis injections, including hospital admission and visits, delivery of fetus, and secundans. If that's done with dilation or DNC, you would code 59851. If that's done with a hysterotomy, failed intra-amniotic injection, it's 59852.